thank you for those of you who stayed. As I said, it's not compulsory to stay beyond 4 o'clock. And I know some people had to go to catch trains and whatever else they have to do. So this is not a formal feedback session, but we would like to try and capture some of the ideas so that those watching online, hello again, can have some idea what we've been talking about. I'd just like to say thank you again for coming. I don't know about you, but I've really enjoyed today. I really didn't know whether people would come to an event like this, but they have. And I'm hoping this can be just the start of something. So,
yes.
Yes, well, thank you. Put your hand up if you enjoyed yourself today. Okay, I think everybody's hands are up. No.
It's unanimous.
It's unanimous.
Yeah.
Good. If you didn't put your hand up, we're going to tell you, come up here and tell you why you hadn't enjoyed it. But no, I've enjoyed it. Thank you. And thank you again to our sponsors. And thank you again to Calderdale Council for helping us use the venue and everything else. And yeah, the thing about unconferences is they're very unstructured, and very often people just go away and that's it. But I did want to make sure that something comes out today. So I do want people to give people the opportunity to have a feedback and talk about ideas they've discussed today that might be taken further. So I'm not quite sure how to do this. I don't want to formally go through this grid and say people come and report on all these things. But maybe ask for volunteers. Is there anybody who wants to come up here and say something about what they've discussed today?
Stand up and say I've met my first witch for a long time.
For a long time? How long?
No, I have a vague feeling I've met one or two others, but I'm not sure.
Okay. So, how many unconferences can say they've introduced somebody to a witch? Yeah. Oh, can I just ask you, how many of you have never been to an unconference before today? Oh, that's probably the majority.
And
would you go to another one?
Yeah.
You would. Somebody said to me earlier on, and I had this conversation with somebody on Twitter, you know, the thing is, whenever I go to a conference, the best bits are the breaks when you get to talk to people. What a conference does is it turns that round, so the breaks are actually the sessions. And somebody on Twitter said, why are groups sitting together who know each other at lunch? And I said, there's nothing wrong with that, because at a conference you sit with people you don't know in the sessions and talk to them. And then in the breaks, you can report back to your friends. So I have no problem with people sitting with their friends in the breaks, because that's where you get a chance to report back and share information and say things you might take back to the office.
Can I ask a question?
Yeah.
Do you know who invented this phrase, unconference, which looks uncommonly like United Nations conference?
Who came here thinking they were going to a United Nations conference? No, I don't know who invented it. Do you know, Paul?
Yeah, there is such a word.
Yeah.
It's all right to invent a word. There's no reason why you shouldn't.
No.
Shakespeare did it all the time.
I certainly didn't invent it. It's been around a few years. And as Elaine says, there's something called open space, which has been around for even longer, which is the same sort of thing, really. Yeah. It's called different things. It's called open space, conference, whatever. But you see, really what it is, it's about sharing collective brain power rather than experts standing at the front telling you what to think. You know? Personally, I think those sort of conferences have had their day. I mean, more collective brain power being put into issues like this.
Can I speak again?
You certainly can.
I spent 19 years of my paid working life as a so-called lecturer in so-called general studies in a so-called technical college. And I got away for most of that time with inviting my classes, if they would like, to try to run their own class. And I learned a great deal from that. I don't know if I need to say anything else, except that if I could only concentrate on one thing for 5 minutes, I could write some quite funny books about it. Some very strange things happened, but it was utterly fascinating, and I think there's a lot of lessons to be learned.
Right.
Couldn't agree more. Right, so, who wants to come and say something about the session they were in?
I will.
Yeah, go on. Well, thank you. Well volunteered. Come up here.
I don't know what to say, and it's probably very short. We talked about the intersectoral working, which is the posh way of saying how do we work together. And let me look at some notes. We talked about things like social prescribing and other, I think this was a different area somebody was telling us about. They have social prescribing, and then they have something called wellbeing practitioners in the surgery. And I thought that sounds familiar, because we've got something similar where we've had different services doing similar things, and not everybody knowing what everybody's doing. At the same time, we're trying to sell that to the doctors to get them to then refer back to us. And actually what came out of that discussion then was, there's a difference between partnership working and intersectoral working, I think. And what we're looking for, the thing that we're really searching for, is the systematic referrals, and where that works, where that has worked, like for example with, I think it was a lady from the Alzheimer's Society, where GPs, not GPs, memory services at the point of diagnosis automatically refer into the Alzheimer's Society. It's systematic, therefore they get the referrals. As much as we value self-referral, as much as we value our partners in the fire service giving us referrals and things like that, we need to have those systematic referrals coming from databases. And the solution to that might be that we have to give, there's a financial incentive to GPs to do it, but I would be really open to having a conversation with anybody in the future from other services about how they might like to get over the data protection problem, because we also talked through that and decided that that isn't a good enough excuse, and actually there are ways around it. And it might be being seconded into a doctor's surgery, it might be sitting with somebody in adult health and social care and interrogating their system, or somebody in another service sending a letter out on behalf of us, or something like that. Okay.
Thank you very much. Who else wants to come on?
I'll do a quick session if you want, John.
Thank you, Zoe.
We were talking about how to improve people's outcomes in hospital, and it was quite a wide-ranging conversation. I don't know if anybody's here who was there, but one of the takeaways was definitely that volunteers and volunteering has a huge role to play and should perhaps be more formalised. So one has a paid role within a hospital to then encourage the creation of groups of volunteers to get involved in people's care. I'm sure everyone's heard of St John's campaign, who've been encouraging hospitals to strip away those limits on visiting hours for people who have carers, and so the carers can go whenever they like. And they should be seen as people who can actually help rather than get in the way of staff. So we were having a conversation about that. And empowering people generally, rather than what is the default in hospital, to actually disempower people and expect them to be passive recipients, when certainly those capable of getting involved in their own care might have a role to play, and those perhaps who have carers, again, have a role to play with that. Lots of other conversations. Systems to help staff. We were talking about both implementing little changes and then bigger blue sky thinking, which is often a deep hole for huge amounts of money to be spent, but little things where staff and patients as well can see changes that could be done and implemented, and there's a suggestion that there is no pathway for those things to be implemented, and so how does one help staff and patients actually deposit those ideas with somebody who's actually going to take them forward? I think that's probably about it on that.
Okay. Thank you very much. Anybody else? David?
Yeah, just kind of recapping a bit on the session that Drew and I did and joining it up a bit with things that we heard. We talked about inventing fictitious characters, personas, telling their stories through life and drawing the social relationships and networks that they had at one level, personal level, but also in a community, going beyond the directory of organisations into who knows who in the community, and consequently who might help with referrals, passing on advice. Then how do you join up people's personal networks with the community networks, and particularly when people's personal networks fracture or they don't have very strong networks because they're isolated. How can you use the idea of network maps to help? I think quite a few people said, well, actually, we're already doing a bit of that. We don't use smart software to do it. We sit down with somebody and use a bit of paper to draw up who they connect with. And yes, it would actually be quite useful rather than just having a directory, that if we could do more about the connections, because without those connections you won't get the referrals that you wanted. So I felt that our slightly theoretical work was connecting possibly with people's reality. So I think we were really interested if anybody's doing stuff on the ground like that, are there some really small steps? And I think you mentioned kind of small steps. Don't have to get into any great fancy major software mapping exercise, but what could be done that make that work that people are doing a little bit easier and a little bit better, and who's up for a bit of experimentation? And we'd be very happy to join up on that.
Very much. Anybody else?
I'll very quickly tell everyone how important the rest of people in the group.
As a very depressing way of ending the afternoon, we talked about planning for future care. So so that's something that affects pretty much everyone at some stage in their life. So as it is at the moment, people buy care in a crisis. They don't consider talking to people in adult social care at the back of the room until there's a point where they can't go on any longer with informal care or with their existing social networks. We didn't come to any solutions, but we talked about lots of ways in which we could help people to think about it more and help people to talk about it more. And some of that's through things like storytelling. So having those conversations about what's important to me, what's important to my life, what do I absolutely not want. And that needs to happen earlier. We also talked about how you plan for the financial side of needing care in the future. Which turned into a bit of it's a postcode lottery, as somebody quite rightly said. So in one area you might need to pay for all of your care, in another you only need to pay for X, Y or Z. And there's no clarity and there's no transparency around that. And the last thing we talked about was that we need to help the general public, because in this room we all understand care quite well probably. But we don't, the general public, if you ask them what care options were available, they probably not have a huge amount of idea apart from being at home or being in a care home. And really there's this whole pathway in the middle, and we need to start helping people understand what that is better. And that was about it.
Brilliant. Thank you very much. Anybody else? No? If nobody else wants to say anything, I'll do a quick bit of feedback on two sessions that I ran. One was about how do we use technology to break down social care and social isolation. And I went into one of my usual rants about people who say that old people don't do technology. Yes, they do. It's just you just have the wrong method of introducing them to it. And we need to do more patient work that's around fun and enjoyment and personal connections and human interactions, and less putting people through courses and making them sit down at keyboards and forcing people to do stuff they're not comfortable with. And the unfortunate thing is the funding gets pumped into things that generate big numbers, but the big numbers don't have an impact because they're short-term interventions that don't actually affect people's lives. And I can recount some wonderful stories about people who've been turned on to new technologies because the right methods are used, and so could some of the other people who were in that session. But I'll also tell you some horror stories about people who've basically been put off technology by having introduced them in the wrong way. So we need to put much more resource into fun, interactive, caring ways of introducing people to technology. And then the other session I ran was about robots in social care, which was a bit of fun really. It was a bit of a provocation in which I started in recounting what Professor Heinrich Wolf said at a presentation I videoed a couple of years ago about the fact that the Holy Grail is developing the bottom wiping robot. And if we can do that, we've cracked it. And we talked about whether it's desirable to have robots in social care. And I think we decided in the end it was desirable, but not exclusively. And that we should not use the human face and human interaction. And one of the things that we talked about was, are we putting people off the idea of robots by trying to develop robots that look like humans? Because they actually end up being scary and creepy. And actually the best robots are ones that look nothing like humans. So that's something to consider. But we did decide that robots in social care was a good thing, as long as it wasn't used to cut out the human interaction. I suppose that probably could be a message for today, really, is that, you know, technology is a good thing, progress is a good thing, but at the end of the day, we should remember that, we shouldn't forget that word care. That word care is really, really important, and it gets forgotten about too often. So, unless anybody else has got anything else to say, I'd say just thank you for coming. I really enjoyed today. I want to do more of this. I want to make sure that some of the ideas we've discussed today get followed up. And thank you to those of you watching on the internet. Hope you've enjoyed participating from afar. And carry on watching the hashtag, because we will write up these sessions and we will follow it up and implement some of it, definitely. Can I just say to anybody who's written notes from sessions, can you send them to me if you can? If you've got them handwritten, you can give them to me. If you could take them away with you and type them up, that would be really helpful. And then email them to me. But thank you for coming. Have a safe journey. Some of us are going to the pub now, which is the Three Pigeons, which is just over there. Basically, you go left out the door, and then right at the end of the drive, and then left the roundabout, and it's there. So
Just up a little hill.
yeah, just up a little hill. I will see you there when I finish packing up.
Thank you, John.
Thank you.
Thank you very much.